And what is the side effect of epidurals or anesthesia? Respiratory depression. So that's why we use Narcan, because Narcan brings back the respiratory. It restores respiratory. Okay? Narcan restores the respiratory system, and an adverse reaction of epidural or any type of anesthesia is respiratory depression. So you see why they go hand in hand together? Okay. When we give Narcan or naloxone via IV, it's never going to be us. It's going to be us as RN, actually. So it will be us eventually one day. We will administer it slowly. Because if we administer a very fast push, what's known to be a bolus amount, that patient is going to be in such severe pain, they may jump out of bed immediately. Okay? Why is naloxone given through slow IV push to reverse respiratory depression and Solomons? Solomons mean not breathing well. It's more effective. A smaller dose is required if given in that manner. It's less painful. Giving a rapid bolus will cause withdrawal and return of intense pain. Giving a rapid bolus is going to cause withdrawal and return of intense pain. That's why we do it slowly through IV push. You guys know what RR is, right? Thank you. Okay. Just so you know, this test only gives you A, B, C, and D. So, I gave you 4. It's a select all that applies. So for the evaluations of patients on Narcan, it's all of them. Which one do you guys use if there's an opioid overdose?
Narcan.
Which is? No. Generic name? Naloxone. Okay, what does opioid naive mean?
Someone that has not taken
An opioid before. So if the patient is an opioid naive patient, they are going to be the patient we monitor the most. We are going to monitor them very closely because they don't know what effects the opioid is going to have on their body or their respiratory tract. Which patient given an opioid analgesic for acute pain should the nurse monitor most closely for respiratory distress? The patient with cancer taking morphine sulfate regularly. The athlete who is taking Percocet for leg injury. The man who has never used an opioid pain medication. The methadone client with a broken arm.
C.
The man who has never used an opioid pain medication because he's opioid naive. Just like methadone, opioid dependency is the same. So like methadone, the dosage varies on the length of addiction. What's the most important criteria in determining the treatment plan for somebody who has opioid dependency? The patient's age, the patient's sex, the patient's weight, duration of addiction.
Duration of addiction.
Duration of addiction.
What was the question for that one?
What's the most important criteria in determining the treatment plan for somebody who has opioid dependency? And its duration of addiction. That's usually the main question. How long have they been addicted to this drug? Because the longer the addiction, the higher the dose we start them off on. When it comes to ongoing assessment for anybody who's on an opioid antagonistic, you are going to monitor blood pressure, you're going to monitor pulse, you're going to monitor respiratory rate, and you're going to monitor level of consciousness. Select all that apply. Okay. Give 0.7 milligrams naloxone IV. Available is a vial with 1 milligram per ml. How much will you give? We are supposed to give 0.7. Available is 1 per 1 ml. 0.7? Yes, that's the answer. We are going to administer 0.7 ml. D over H times Q. So, the doctor ordered 7 milligrams. Available is 1 milligram per 1 ml. So 0.7 divided by 1 times 1 equals 0.7. Okay. When it comes to an intervention that we do while they're on an opioid antagonistic, we need them to promote the most optimal response to this medication. And in order for them to do that, we have to continuously monitor their pain level. Because if a patient's in pain, they don't want to breathe because it hurts to breathe. You understand what I'm saying? And we want an optimal response to the antagonistic. The antagonistic is supposed to what? Restore the breathing. So if they're in pain and they can't breathe because of the pain, is that an optimal response? No. We're ignoring our jobs. Because while we're giving them Narcan, we have to say, What is your pain level right now on a scale of 1 to 10, or 0 to 10, 10 being the highest? Continuously throughout the whole time they're on the Narcan. Because we just said Narcan brings all the pain back. A patient has been prescribed naloxone for respiratory depression. Which of the following interventions should the nurse perform to promote an optimal response in the patient? Monitor for an increase in body temperature. Monitor for any signs of dehydration. Balance the need for continued pain relief with patient's ability to breathe. Administer the drug through a rapid IV push. Exactly. Balance the need for continued pain relief with the patient's ability to breathe. And when it comes to people we use opioids cautiously in, what do you know about mothers who are breastfeeding?
They can't give after 24 hours.
Exactly. A patient is prescribed an opioid antagonist. The nurse knows that which of the following statements in the patient's record will require a cautious use of the opioid antagonist. Patient has liver impairment, patient is lactating, patient has renal failure, patient is hypersensitive to the drug.
Lactating.
Exactly. Because every other one are contraindications for opioids. Meaning you can't give those to those people because you'll make those diseases worse in those people. Okay? So if you have a liver problem, a renal problem, or you have an allergic reaction to the drug, you will never give an opioid to those patients. Those are contraindications for opioids. Renal, liver, and hypersensitivity. But cautious people who are lactating. They can still take it, but they're either going to have to pump and dump, or they're going to have to wait a full 24 hours before they even pump and dump. Okay?
So you never give an opioid to...
No opiates, no opioids.
No opioids to anybody who has liver problems, renal problems, which are kidney problems, and hypersensitivity, which means allergic reaction. That's it. That's all 20. Okay. Did anybody miss anything that I need to go over again, or are we just copying someone's notes and that's what you're doing? That clock is off. All day long I've been an hour behind.
Yeah, it's almost 6. So
Yeah, and I had no idea. That's why I didn't take lunch today, because I thought I still had time to take lunch, and then people started showing up, and I'm like, whoa, what happened?